Okay, good afternoon, everyone, and thank you all for being here. As Dr. Latshar stated, my name is Joseph Wilson, and my essay topic is All in the Neighborhood, the Impact of Unhealthy Housing on Asthma Disparities in Baltimore. This is a picture of Baltimore, and Baltimore is a tale of two cities. On the right, we have the Inner Harbor, which is a popular tourist attraction, and on the left, we have what I would consider the actual city, which has its typical row homes. Now, there are various types of problems that may affect Baltimore, but one that should be mentioned is asthma. Now, asthma is a chronic respiratory illness that affects over 25 million people, and Baltimore is no exception. Baltimore ranked 19 out of the top 100 largest cities where it is challenging to live with asthma. It also has one of the highest pediatric hospitalization rates and ER visits due to asthma in the nation. When comparing Baltimore to Maryland, we see that Baltimore has the highest asthma rates in the state, with 12% of adults and 20% of children having the disease. But while asthma is a disease that affects the city as a whole, its effect is not equal across residents, as we see that 15% of African Americans have asthma compared to 8% among white residents. There's also a disproportionate morbidity in low-income African American neighborhoods. Now, when we discuss the prevalence and exacerbation of asthma, there are various factors that must be considered. We must, in particular, consider the influence of systemic social, economic, and political factors. One such factor that displays the relationship between asthma and these factors is the state of one's housing. Now, healthy housing is defined to be a dry, clean, well-maintained and ventilated place of residence that is free of pests and contaminants. It may seem like a very complex definition, but it is important to understand that all of these elements are crucial for someone to have a healthy home. Research has shown that the health and well-being of individuals are connected to the state of their home. There are direct aspects, such as if the home has moisture problems or is not well ventilated, as that could lead to asthma triggers. You also have indirect aspects, such as the sense of community and access to needed resources. Research has also shown that there is a relationship between living in an urban area and having an increased prevalence and morbidity of asthma. But while we know that this relationship exists, we must remember that urban areas are not homogeneous. For example, I'm from Augusta, Georgia, and while Augusta is also on the list of having a high rate of asthma, its social context, its historical context is very different from Baltimore. So by understanding this socio-historical context, we can better understand and have a more holistic understanding of how housing is related to asthma in Baltimore. There we go. All right. So when we talk about Baltimore's housing history, one concept that frequently comes up is the idea of redlining. Now, redlining, for those of you who may not know, was a system enacted by the federal government in the late 1930s that was maybe about over 50 cities in which they marketed areas where it is pleasant to live in and areas that it is okay and acceptable to receive a loan to actually buy a house. When we look at this map here in the corner, these red areas are areas that were deemed unsafe to live in, areas in which homeowners should not expect to receive a loan from. These areas in Baltimore consist of the west side of the city, the south side of the city, and the east side, which are predominantly African American neighborhoods. Now we see on this map that redlining lasts up until around 1968, but it is not the only idea, it is not the only policy that should be considered when we talk about Baltimore's housing history. This is a more complete definition or complete history of Baltimore and its housing system. It really goes back to the 1790s when Baltimore was founded, but we are starting here in the 1900s when we actually see some of these policies up front. For example, we can start with segregation ordinances, which dictated where African Americans and whites could live and not live. Baltimore was the first city in the nation to enact such ordinances. You also had restrictive covenants in which neighborhood associations stated we will our neighborhood is only for our people. Black individuals and other minorities are not accepted into our area. As we go on throughout the middle of the 20th century, we have the start of segregated housing projects, so much so that in the late night in 19 in the 1900s, the late 1900s, so 1999, Baltimore was considered to have to be one of the most segregated places in America. When we look further on into the beginning of the 21st century, we have the problem of vacancies happening disproportionately in black neighborhoods. Now, this is only a brief history, a brief timeline of Baltimore's housing history. But it is important to understand that these racist policies, let's be real, they were racist, ended up in black individuals being limited in their economic and social mobility. It supported stereotypes about black individuals, and it made sure that they stayed in segregated housing areas, many of which were very unhealthy. So when we talk about asthma and housing, excuse me, when we talk about asthma and housing, one way to understand this relationship is through the social ecological model. This model looks at the individual, relational, community, and structural levels of a particular issue, and also how all of these levels are combined or intertwined and are related to one another. For example, when we look at the individual level, such as an individual's home, we see that exposure to asthma triggers, such as mold and pests, due to adverse housing conditions, can lead to asthma morbidity. When we look on the relational level, we see that the housing condition of the neighboring homes can also have a prevalence of these asthma triggers. In addition to vacancies, so these vacancies are known to be related to increased crime rates and also adverse housing conditions. In Baltimore, as I stated, the housing system are many row homes, which means the homes are stacked next to one another. So it's very likely that a neighboring home could have asthma triggers. Your home may also have it. On the community level, we have the type of housing and access to resources such as green spaces, which have been related to increased asthma control. And on the structural level, we have residential segregation, which has been shown in the literature to be related to asthma and housing and not having access to the resources that they need. When looking at the social ecological model of asthma and housing related to Baltimore, this map is very helpful. So on the right, we have the asthma hospitalization rates in 2011. On the left, we have the same map of Baltimore, but we are seeing high rates of toxic air pollution. The three zip codes that I have here, 21205, 21217, and 21223, are predominantly African American neighborhoods that are three of the highest zip codes that have these asthma hospitalization rates. So when we look at this social ecological model in relation to Baltimore, we will use these three zip codes as an example. On the individual level, research has shown that the homes of asthmatic Baltimore children had more disrepair and allergens than suburban children. There was a disproportionate increase in vacancies from 2000 to 2010 in the Old Town and Middle East neighborhood, which is 21205. In 2017, Sandtown Winchester, 21217, had the highest vacancies in the whole city. On the community level, research has shown that zip codes with higher black populations, vacant homes, and a lower median income were significantly more likely to have elevated asthma levels. And on the structural level, we see that the Sandtown Winchester neighborhood, which is 21217, experienced overcrowding and slum clearing since the early 1900s and experienced displacement in the 1950s through the 1970s. 21223 is Southwest Baltimore, which experienced similar issues, and 21205, Old Town Middle East, experienced urban displacements for the Hopkins Broadway project. So moving forward, what can we do about this issue? Here I have color-coded various solutions in relation to its level on the social ecological model. So on the individual level, we can promote integrated pest management, which is a comprehensive and a holistic way to address pests that includes education, prevention, and even pesticides if necessary. We can modify the built environment by ensuring that there are more green spaces in these neighborhoods and making them more pedestrian friendly. On the community level, we can focus on community-based interventions that center the voice of the community and ensure that their needs are not only met, but that they are on the forefront of ensuring that they can lead out this project and see that their needs are met. And finally, we need legislation that will combat these racist policies and ensure that all residents can live healthy in Baltimore. But also, it is very important to listen to the stories of these residents. Yes, it is good that we can do all the research and put them in journals, but if we are not listening and centering the voices of these people, our work may be for vain. So in conclusion, we have a map of Baltimore and its asthma levels, but a list of various resources that will that is just stressing the point that these 4 levels of interventions can work alongside these asthma resources that are already present in the city of making a healthier Baltimore. In conclusion, I would like to acknowledge my advisor, Dr. Jennifer Nuzzo, my second reader, Dr. Daryl Gaskin, Dr. Latshaw, my family and friends. Thank you, and I'll take any questions.
Thank you, Joseph. Very engaging. Questions for Joseph?
Megan, not question. This is Jennifer. I just wanted to congratulate Joseph on a great project. Joseph, I learned a lot, and I really appreciate being able to learn through these long, hard efforts of yours. So thank you. And I really like how you summarized it. Reading it was great, but particularly the way you showed it on these slides, I think was really compelling. So that's going to serve you well going forward, just your ability to communicate fairly dense and compact. You know, there's a lot of factors in there, but you really distilled it out, and I liked how you used this conceptual model throughout it and tied everything back to that. So just congrats.
Thank you so much, Dr. Nuzzo.
I don't know if you have time for a quick question, but Joseph, I want to thank you for a really engaging, kind of well thought out presentation there. And I know you were involved on a lot of legislative work around policies this spring session. Moving forward for next session, what would you think is like highest priority policy piece that can be pushed forward kind of to combat some of the context you really explained through there?
Well, Toby, thank you. Well, quickly, I think there are just various issues that could really be addressed concerning legislation. But one project that I worked on this past semester wanted to actually have mold regulations for the entire state of Maryland. So as we know, mold is a common asthma trigger, but there are no regulations that dictate how it should be cleaned up or any repercussions for landlords that are keeping residents in those unhealthy environments. So by having various standards that are uniform across the state, we can ensure that residents have healthy environments. But again, that's only the first step, and that's just some of the work I've done. Hopefully down the line, we get some more people to help get this problem solved.
Amazing work, Joseph. Thank you so much.
Thank you.
For